limit your alcohol intake. If you're not a rock star, you shouldn't be drinking alcohol every day and expect you to have a good blood pressure. You got to limit that to on occasions. Your birthday is not every day. Hello, everyone. Welcome to Doctor with Dr. T, powered by Tecordia, the complete health management solution for you. Now, today we're going to talk about high blood pressure, which is also called hypertension. Before we go further about high blood pressure, let's define what is normal blood pressure. Normal blood pressure is anything that is less than 120 over 80. Any numbers that are less than 120 over 80 with no symptoms, that's normal blood pressure. Elevated blood pressure is the top number, which we call systole, is between 120 to 129, and the bottom number is still less than 80. Stage 1 hypertension is when the top number is between 130 to 139 and the bottom number between 80 to 89. And stage 2 hypertension is any blood pressure that is 140 over 90 or higher. Of course, we also have hypertensive emergency, hypertensive crisis, when you have those numbers much higher than that with symptoms. And we're going to talk about that later on. Now that we understand the definition of high blood pressure, let's talk about the causes. 90 to 95% of the time is going to be called essential hypertension, which means we don't really know what causes it. Now, there are certain risk factors that make it more likely to have essential hypertension. Number one is age. As we all get older, those arteries are become more stiffened and hardened. We develop essential hypertension. But also there are genes in terms of family and trees that have a lot of people develop essential hypertension at an early age. There are also lifestyles such as sedentary lifestyle, food, diet, what type of food that you eat, especially salt, which I have right here, is a big culprit of high blood pressure all over the world. I also have certain medications, commonly used medication like Advil, ibuprofen, those type of medication, birth control pills, certain steroids medication. Those medications can also make you develop high blood pressure. Okay. Now, there are also what we call secondary hypertension, and those are caused by certain disease, such as renal disease. If you have many forms of kidney disease, that can make your blood pressure go higher and develop hypertension. You can also have certain endocrine disease where your own body secretes certain types of hormones that make your blood pressure go high. You also talk about drugs that can cause that. Many drugs, not just the medication that we provide, but also some illicit drug, in the street like cocaine, like amphetamine, and many other drugs that can cause hypertension. The other big culprit of high blood pressure also is smoking. Smoking can make your blood pressure become higher, and alcohol intake is another one. Excessive alcohol intake can also make you develop hypertension. Stress, chronic stress in your life, lack of sleep, all those can cause secondary hypertension. Now, let's talk about prevention of high blood pressure, okay? Suppose you have a family of high blood pressure. Your mom, your dad, your uncle develop blood pressure at an early age. How can you prevent that from happening to you? Well, there are certain things that you can do. For example, you can start by salt. It's right here. Salt. That's one of the biggest culprits of high blood pressure, especially secondary causes for blood pressure all over the world. So that is about 5 to 6 grams of salt. 5,000 milligrams. So in one day, you should try to consume less than 2 grams of salt, which is less than 2,000 milligrams. And the way you do that is by reading label. Know when you're getting over the limit by trying to control yourself. That is one of the biggest culprits of blood pressure because all of our food are full of salt. Okay. Second thing you can do, develop a regular exercise activity, whatever you like to do. For me, it's golf. I like to golf. I golf, so that helps me a lot, and I walk the golf course. Okay. For other people, it's running. For some other people, it's swimming, basketball, soccer, whatever activities you like to do every day that keep you moving, that will help decrease your blood pressure. Also, the type of food that you eat. You try to get what we call a diet full of legumes, vegetables, less saturated fat, less cholesterol, less sugar on the diet, more natural diet. All of that will help decrease your blood pressure. I don't want to name any other diet just so we don't go after your brain, but the type of food that you eat will also help you. Try to maintain a healthy weight. Try to keep your weight, reasonable, your what we call the body mass index between 25 to 27. Perfection is the enemy of good, but at least trying to be closer to good so you can keep your blood pressure low. Limit your alcohol intake, occasional alcohol intake. If you're not a rock star, you shouldn't be drinking alcohol every day and expect you to have a good blood pressure. There are a lot of problems that come with increased alcohol intake, but if you want to prevent blood pressure, you got to limit that to on occasions. Your birthday is not every day. So you cannot be drinking every day and expect to have a good blood pressure. Smoking, that's another big one. You should not smoke. Not only it has many other, medical complications that happen with smoking, but high blood pressure is a big one. So you should not smoke. Then that will decrease your chance of develop high blood pressure. Stay away from certain medications. So certain drugs will increase your blood pressure. If you have pain, trying to use more Tylenol versus Advil versus Motrin, because using those medications every day will increase your chance of having blood pressure. Try to manage stress in your life, meditation, yoga, sports. For me, golf, walk, other sports, work, playing with my kids. So there are a lot of things you can do to prevent that disease from taking place in you if you know you have risk factors in your family to develop high blood pressure early on, okay? And of course, if you have a family history of high blood pressure, you should also get screened often, at least once or twice a year early on. And if your numbers start to creep up, getting closer to that 120/80, then more frequently, maybe monthly, a blood pressure monitor device, a blood pressure device to measure blood pressure. Very cheap nowadays. In less than $30, you can find a good one. So that will help you stay ahead of the game by monitoring your blood pressure. Lastly, we got in prevention, coffee. As much as I love coffee every day, if you have high blood pressure, you got to know what is the effect of coffee on your blood pressure. So you got to try to measure your blood pressure before coffee and after coffee to see what is the effect of that. And in fact, any caffeinated drink, drinks that contain a lot of caffeine can increase your blood pressure substantially for some people. So it's very important to know what is the effect of coffee on your blood pressure so you can manage that appropriately and not consume coffee a lot in order to prevent having high blood pressure.